throat, and the host reaction, immune reaction that generates the acute inflammatory response. And for secondary prevention, the goal is to prevent recurrent episodes of acute rheumatic fever. Now, the treatment for rheumatic heart disease and acute rheumatic fever has not changed for many years. Essentially, penicillin has been used for the treatment of rheumatic fever and acute rheumatic heart disease and rheumatic heart disease. Penicillin is an antibiotic which is widely available and affordable. And up to date, very few reports of resistances have been reported. Rheumatic heart disease has been eradicated in developed countries with prevention strategies, primary prevention strategies associated with other strategies like primordial prevention. If we look at this figure in the USA, we can see that around the 1940s, when penicillin was widely introduced, the mortality due to rheumatic heart disease declined gradually, but before that, the mortality was already decreasing because of improvement in the living conditions and housing due to primordial prevention. Primary prevention relies on the proper treatment of streptococcal pharyngitis to prevent the first episode of acute rheumatic fever, and primary prevention interrupts the link between the strep infection and the body's response that generates the autoimmune reaction. If given early in the infection, penicillin stops the body from developing an autoimmune reaction. Now, this requires that we need to identify people who have strep infections, those who are infected with strep, those who have sore throat, and those who are at risk. Penicillin is widely available, as we said earlier, but what we notice is that many people are not aware of sore throat and rheumatic heart disease. In our practice, we used to receive a lot of patients with rheumatic heart disease, and when we asked them if they've had sore throat in the past, many of them said yes. And then we asked them, how was it treated? Many of them said they were being treated with salt water or charcoal, and this, we kept thinking. So this prompted us to carry out this survey on rheumatic heart disease awareness in Boya, and what we found was that only 5% of the participants had adequate knowledge on rheumatic heart disease, and for those who had sore throat, only 45% received antibiotics, and more than 70% of them did not know the link between sore throat and the heart and the complications of sore throat at the level of the heart. Penicillin remains the first-line drug recommended for the treatment of strep pharyngitis. A single dose given intramuscularly is very effective, or 10 days of oral penicillin as well. And then macrolides can be given in patients who are penicillin allergic. So these are the different regimens. Now, I'd like to talk about the Cuban experience. The Cuban experience is one of the successful rheumatic heart disease prevention programs that were established in the world. And the aim of the project was to look at the prevalence of rheumatic heart disease and evaluate the effectiveness of a preventive program. So the project included primary and secondary prevention, training of personnel, health education, dissemination of information, community involvement, and epidemiological surveillance, as we've seen earlier. Now, in this project, permanent local and provincial rheumatic heart disease registers were established in all hospitals. Educational activities and training workshops were organized at provincial, local, and health facility level, and thousands of pamphlets and hundreds of posters were distributed, and special programs were broadcast on public media like TV and radio to advertise the project. So these are still the components of the project. Here we have primary prevention, secondary preventions, and then the other components of the projects like personnel training, health education, dissemination of information, community participation, and epidemiological surveillance. Now, the project was carried out for 10 years, and 5 years after the end of the project, it was realized that the total incidence of rheumatic heart disease decreased, as you can see, 5 years after the end of the project, as you can see here. And regarding the incidence of recurrences of acute rheumatic fever, the decline was much more compared to the total infections. So we can see that primary prevention can be effective in reducing the incidence and the severity of rheumatic heart disease. Now let's look at secondary prevention briefly. Now the aim of secondary prevention is to prevent repeated attacks or recurrent attacks of acute rheumatic fever and to slow rheumatic heart disease progression in those who have latent rheumatic heart disease or moderate rheumatic heart disease. And the gold standard drug for this is benzathine penicillin, which we already know, usually administered as a single dose every 4 weeks. Now, the duration of secondary prevention, however, depends on many factors. The patient, demographics, the severity of rheumatic heart disease, and other risk factors. So that's how it's administered. Now, secondary prevention strategies diminish it's associated with pain. We all know that when we administer benzathine penicillin, it's very painful. Now, there are strategies to reduce pain by associating the injection with lidocaine, and efforts are going on to develop an implantable device that can deliver the penicillin like we have for the insulin pumps in diabetic patients. And there is recent evidence indicating that secondary prevention is very beneficial in latent rheumatic heart disease. In a recent trial that was published in the New England Journal, the GO trial showed that rheumatic heart disease reduced the progression of, rather, penicillin reduced the progression of latent rheumatic heart disease by 0.8% in the prophylactic group compared to 8.2% in the control group after 2 years of follow-up. So in conclusion, we can say that rheumatic heart disease is preventable almost entirely, and penicillin still remains the gold standard antibiotic for prevention of acute rheumatic fever and rheumatic heart disease, both in primary and secondary prevention. And if rheumatic fever or if rheumatic heart disease do occur, long-term antibiotics can reduce the progression to more severe lesions. Community and provider awareness are the pillars of a successful primary prevention program. So here we can see in some prevention programs in some countries like in Kenya, where in school children, they were educated on rheumatic heart disease. If you have a sore throat, present with cough, runny nose, that will cause rheumatic fever, rheumatic heart disease, and you can have a broken heart. So these are some of the posters and pamphlets that were used in these programs in some of these countries. Here is another pamphlet. If you have rheumatic fever can damage your child's heart. So if your child has a sore throat, you take the child to the health center for the child to be treated adequately with antibiotics. To prevent rheumatic fever, take your child to the doctor as soon as he or she has a sore throat. So these are other pamphlets used for prevention in other countries. Here is in Australia, here is in New Zealand. My brother almost died of rheumatic heart disease. It started with a sore throat. Thank you.
Thank you too. Très bien, bon, nous sommes arrivés au terme de cette session.